A 70-year-old woman with rapidly progressive ataxia, a case record of the Massachusetts General Hospital by Bart Felice and colleagues. A 70-year-old woman presented to the hospital with rapidly progressive ataxia. 3 months earlier, fatigue and general unsteadiness developed. The unsteadiness worsened and the patient was no longer able to walk in a straight line or to remain stable in yoga poses that had previously been easy for her. She was evaluated by her primary care physician. Laboratory tests and a neurologic examination were reportedly normal. 4 weeks before admission, progressive gait imbalance developed. She was evaluated in a neurology clinic. Imaging of the head and evaluation of the cerebrospinal fluid were unremarkable. Her condition did not improve with immunosuppressive therapy, and memory loss developed. This patient presented with rapidly progressive ataxia, an impairment in the rate, range, and rhythm of voluntary movement that was unexplained by weakness. The differential diagnosis was focused on a subacute progressive disease that started in the cerebellum and spread to other parts of the central nervous system. Sporadic Creutzfeldt-Jakob disease is the most common human prion disease. The cerebellar form is characterized by a cerebellar syndrome with no evidence of cognitive impairment in the first month of illness. The mean age at onset is 63 years, and the first symptoms that occur are most commonly gait dysfunction, dizziness, and incoordination, all of which were consistent with this patient's presentation.